what do you hope to apply from this work? I have so many questions, but what is your kind of vision for how providers can kind of learn from this case study? Because I mean, him getting to the point of attempting is obviously pretty serious, and so I'm wondering what was missed or how we could kind of get to it sooner. But what is your initial vision of how this can be applied in a clinical setting?
So imagine this kind of patient who was suicidal and like hitting himself with this attempt. So this kind of patient is taken care by the behavioral health because they will think, oh, patient is psychotic. You know how we treat this kind of patient, then he will be in the behavioral, the doctors will evaluate for psychiatric. But we have to look underneath, like deep, could be this is the symptoms that can be from other disease. Insomnia is a general, like is a word, but it can be the symptoms of many disease. So all the differentials should be in our mind. We shouldn't judge a patient that he was suicidal because of like he is depressed, but he was depressed because he couldn't sleep, and that reason was behind, like this tumor was making all the symptoms. That's why he was not able to sleep, and also the low sugar symptoms.
Are these kind of mental health manifestations common with hypoglycemia?
Not really, but somewhat, I would say, because when you get low sugars, at some point you get upset and depressed, frustrated. You don't know what to do. Like how many times you should keep eating and you are gaining weight. You are frustrated. What's going on? Something is wrong with me.
Mhm.
So I would think, like I would say, mental health professionals should also keep look into it. Like this could be symptoms of one of some serious medical condition.
Yeah, that's really because it's fresh on my mind, making me think of things like, e- encephalitis and things like that, which is often misdiagnosed as
Yeah.
mental, because it
Mhm.
has psychiatric manifestations. And in my mind, I'm thinking, oh, if you get admitted, especially for something like an attempt, you're likely to be diagnosed with something and prescribed a medication that then kind of sends you down a rabbit hole. Um, do you think that this is a fairly unique case, or like how does this kind of play into the landscape overall of people with this type of hypoglycemia or even this tumor?
Yeah. So I feel like that's why we wrote the case, because usually the symptoms are low sugar symptoms, hypoglycemia. But I know, like I'm not experienced that much. I started my career last year, but within my short experience and the literature review, it was very unique symptoms with suicidal attempt, not even like depression. It's like a suicidal attempt. This is a lot advanced. I would say the mental health professionals should really take like deep into it, and we always keep our eyes and ears open for this kind of
Mm.
symptoms.